Hi, I'm Dr. Aman Gupta. I'm a urologist and kidney transplant surgeon at Fortis Hospital, New Delhi, India. Today we are going to discuss about a very common problem, which is the urinary bladder cancer. What is urinary bladder? Urinary bladder is the organ which stores the urine in your body. The symptoms of urinary bladder cancer, most of the times people would present with some blood in the urine. There can be one single episode or there can be repeated episodes of blood in the urine. Other people may present with other symptoms like frequent urge to pass urine, difficulty in controlling the urge to pass urine, leakage of urine, or pain while passing urine. Unfortunately, the problem is many people ignore episodes of bleeding. They assume that it can be because of a urine tract infection or it might have been because of some stone. So, whenever there is a bleeding episode in the urine, it should never be ignored and should not be assumed that you had some urine infection or some stone problem. There are other people who would have symptoms very similar to urine tract infections. As I mentioned, they may present with frequent urge to pass urine, painful urination. Now, people may assume that there was a urine infection, they may take antibiotics, the symptoms may get relieved, but the diagnosis is missed. How is urinary bladder cancer diagnosed? It can be diagnosed by various methods. Ultrasound is the first test which we recommend. Very small urinary bladder cancers can be missed on ultrasound. So, further testing is done by a contrast CT scan. Contrast CT scan is more reliable than an ultrasound. However, even this can miss very small urinary bladder cancers. The best and the most reliable method to confirm and diagnose urinary bladder cancer is by means of cystoscopy. What is cystoscopy? We pass a camera through the urine passage, have a look inside the urine bladder to confirm if there is any tumor or not. If there is a suspicion of any tumor, we remove the tumor simultaneously and send it for a biopsy. Who are the people who are at risk of developing bladder cancer? It can happen at any age, but generally it happens in people above the age of 50. It can happen both in men and women. However, people who are smokers and who abuse tobacco, they are the ones who have the highest risk. Other risk factors are people who work in chemical industries such as dyes, polish, aniline, and such chemical exposures increase your risk of having urinary bladder cancer. There are some certain geographical areas where the water has higher contents of arsenic. They are also at higher risk of developing urinary bladder cancer. Another risk factor, somebody who has urinary bladder stones and they have been left untreated for many years, they can also develop urinary bladder cancer. Once a cancer is confirmed, we need to do the staging. What is the stage of cancer and has it gone outside the urinary bladder into other organs or not? So the first step is cystoscopy and biopsy. This procedure is called as transurethral resection of bladder tumor, for which you are given anesthesia. A camera is passed through the urine passage. The tumor is visualized and it is cut by a telescope or using electric current. You remain in the hospital for around 2 days. The biopsy report is generally ready between 3 to 7 days. Once the type of bladder tumor is confirmed, and depending on whether the bladder tumor is superficial or it has gone deep into the urine bladder, the further treatment is decided. So, by and large, there are two types of tumors. The one is that the cancer is only localized to the superficial layers of the bladder, and the others are where the cancer has gone deep into the layers of the bladder. If it is still in the superficial layers of the bladder, that's an early stage, and based on that stage, we have to give further treatments like intravesical immunotherapy. What is that? We give a medication through the urine passage into the bladder. That medication kills the cancer cells in the bladder and it reduces the chances of recurrence of urinary bladder cancers. If the cancer has gone into the deeper layers of the urine bladder, which means the muscle of the urine bladder, then we have to completely remove the urine bladder. This can be done by robotic surgery, laparoscopic surgery, or open method. There are two types of surgeries after removal of the bladder. One is conduit, which means the urine is diverted through a stoma on the tummy of the abdomen. On that abdomen, we make a pouch through which the urine flows outside into the urine bag. There is another method called as new bladder, which means using your own intestine, a new bladder is created so that you can pass urine through your natural passage. However, there are advantages and disadvantages of each, and based on individual criteria, your urologist will decide which method is best suited to you for your treatment. In people who are not fit to undergo a surgery or in whom the bladder cancer is advanced, the other treatment options are chemotherapy and radiation therapy. Apart from this, in certain cancers, immunotherapy is also recommended. For the staging purpose, the first step is a biopsy. The next step would be a CT scan or a PET scan. Based on these findings, your treatment will be decided. Now, what are the preventions? Number one, as I mentioned, smoking is one of the biggest culprit for bladder cancer. One should not smoke or use tobacco in any form. Apart from that, maintaining an ideal body weight. If you have heavy exposure to chemical industry, one should try to reduce that. And the most important part is never ignore any bleeding episode in the urine. If you have any bleeding episode in the urine, you must always go and meet your urologist. Also, if you have recurrent episodes of urine tract infection which are unexplained, that also must be investigated. Lastly, if you have a urinary bladder stone, that should not be left untreated for very long. Thank you so much.